Following are some important causes of progressive RVOT dysfunction after repair surgeries for congenital heart disease. Pulmonary regurgitation, stenosis at the conduit anastomotic site, somatic outgrowth, stenosis of pulmonary valve, kinking of the conduit, compression due to sternal deformity, intimal proliferation, calcification of the conduit, aneurysmal degeneration of the RVOT. Right ventricular outflow tract dysfunction is one of the most important long-term sequelae of repair of Tetralogy of Fallot. This can lead to exercise intolerance, cardiac arrhythmias, and even sudden cardiac death. Percutaneous pulmonary valve implantation has been used in the management of this condition.